Question number 6, Hon Dr Ayesha Verrall.
Mr Speaker, my question is to the Associate Minister of Health and asks, does she stand by all her statements and actions?
Sorry, just do your question again.
Does she stand by all her statements and actions?
Mr Speaker, yes, in particular my statements that I'm absolutely committed to the smoke-free 2025 targets and to providing practical, targeted help so that smokers who are addicted to nicotine can stop.
Supplementary, was she advised by officials that repealing the 2022 amendments to the Smoke-Free Environments and Regulated Products Act would mean that the smoke-free goal would not be met until 2061?
Mr Speaker, I've received a range of advice from officials and we're continuing to develop good legislation and programs to achieve the smoke-free 2025, targets.
Point of order, Mr Speaker. It was a very simple question. Was she advised, yes or no?
You can't ask for a yes or no answer. Well, I think it was addressed by saying that the range of advice was sought. I know you don't think that, but I'm in here and you're not. So, Dr Verrall. Dr Verrall.
Was the Minister advised by officials that repealing the 2022 amendments to the Smoke-Free Environments and Regulated Products Act would mean that the goal was not reached until 2061?
Repetition.
Mr Speaker, as I said, I've received a range of advice. Some of that advice was based on statistical data that was not current, and in the last 3 years we have seen 219,000 people have stopped smoking, with vaping playing a key role. Importantly, 79,000 of those who stopped smoking, 36% of those who quit were Māori. And we are now receiving statistics where we have a smoking rate of 6.8% of New Zealanders daily smoking, which is down from the 8.6%, which was one of the statistics that data was based upon.
Dr Ayesha Verrall.
When she was advised that repealing, how does she justify repealing the 2022 amendments to the Smoke-Free Environments and Regulated Products Act when she was advised that bill would substantially close the difference in life expectancy between Māori and non-Māori?
Mr Speaker, we were absolutely committed to achieving the smoke-free targets, and we are going to implement systems that target addicted smokers and not generalist virtue signalling approaches that are unproven.
Mr Speaker, supplementary.
Supplementary.
To the Minister, has she received reports on the tobacco black market?
Mr Speaker, there has already been a substantial black market for cigarettes and crime attached to tobacco retailing, and Customs are seeing a high volume of seizures of tobacco, both large and small, and through multiple channels, and an increase in large seizures. It is noted that that the previous government invested $10 million in the 2022 budget for a dedicated tobacco enforcement team in Customs, and we will continue with Labor's unworkable woke virtue signalling plans for this experimental prohibition regime will make this problem even worse.
Mr Speaker, why does she refuse to be interviewed on why she is repealing a law that would save $5 billion in health costs, and don't New Zealanders deserve to know the answer to that?
What media?
Mr Speaker, I have been interviewed on numerous occasions on this issue, and I am looking forward to having media interviews on the effective legislation and regulations that we will introduce to ensure that people who are addicted to nicotine smoking will have the tools to quit and that youth vaping will decline.